Welcome back to Great Day Washington. This segment is sponsored by Cosmetic Surgery Associates. Cosmetic Surgery Associates is located in Bethesda, Maryland, and offers the latest in cosmetic surgery procedures.
And joining us today to tell us more about a popular procedure they provide is board-certified plastic surgeon, Dr. Magge. Good to have you.
Thank you for having me.
All right, we're talking facelifts today, right? We hear the term. People may not fully understand. What is a facelift?
So a facelift is a commonly thrown around term, but not everyone knows exactly what it means. It can cause a lot of confusion. I have patients coming in and saying, hey, I'm really bothered by my neck, I'm bothered by my lower face, by my jowls, but I don't want a full facelift. Well, that's exactly the areas that a full facelift addresses. It goes after the neck, the jowls, and the cheeks. It doesn't go after the forehead or the eyes. Those are separate procedures like a brow lift or blepharoplasty. They can be done at the same time as a facelift, but are not addressed by a facelift.
So literally lifting the face.
Lifting and tightening the face.
The bottom here. Yeah. Who is a good candidate to have a facelift?
So patients come in and say, hey, I feel so young. I feel healthy. I feel very vibrant, but I look in the mirror and I don't like the way my neck looks, my jawline looks. They're kind of sagging. My cheeks are starting to sag. And it just bothers me. And those are the patients who would really benefit from a facelift. Typically, the age range is early 40s is when we start talking about a facelift to 70s. Someone who's in good health, they could have medical conditions such as high blood pressure and diabetes, but they should be under good control. Close to their ideal weight. If someone's planning on losing a large amount of weight, like 30 or 40 pounds, it's best to wait until you've lost that weight, because at that point your skin and tissues will be deflated and then you can better reposition it. Someone who wants a natural result, we don't want to do like an over-pulled, obvious result.
These aren't the days of the
exactly.
tight.
Exactly. I tell my patients, I don't want to make you look like you just stepped out of a wind tunnel. You know, we don't want an unnatural look. And non-smokers. If you're a smoker, it really increases the chance of wound healing problems. So non-smokers are the best candidates.
How do you perform them?
So there are different ways to perform a facelift. The scars for a facelift typically are here in the hairline. They're very well hidden. Go behind the ear and then back, and a small one under the chin to help tighten the neck. You can do a skin-only facelift, which kind of lifts the skin and pulls everything really tight. Very few surgeons do that. It's an old type of procedure. It leads to that over-pulled, unnatural look. The scar's a little bit more obvious, and it doesn't last as long. The best type of facelifts involve tightening and repositioning of something called the SMAS layer, which is the strength layer of the face. It's the deep layer. There's a SMAS lift, where you lift up the skin and then take that SMAS tissue and tighten it on itself. That really addresses the jawline and the neck, a little bit of the cheek. I do something called a deep plane facelift. You lift up the skin and then you lift up that deep SMAS layer, that strength layer. We age because what's up here starts to droop and fall. So then I release those ligaments here in the cheek and reposition everything back into its natural place. It leads to a more harmonious result because the cheeks are addressed, the jawline's addressed, the neck is addressed. You avoid an over-pulled look, and then basically I just lift the tissue, put it back where it should be, and then trim the extra skin.
It sounds easy. Maybe painful? Are you put under anesthesia for this?
So you do need anesthesia, but you don't need general anesthesia. I, more often than not, perform this under sedation. We call it twilight sedation. Basically, a little out of it, we numb up the face. Typically, patients are snoring through the procedure. They don't need a breathing tube, so you don't have kind of that sore throat. It's an easier, faster recovery.
All right, so if somebody's interested, what should they be looking for in a doctor?
So one thing is that you want to make sure the surgeon is board certified by the American Board of Plastic Surgery. That's the only real accredited board for plastic surgeons. It means you've gone through prerequisite surgical training, you've gone to an accredited plastic and reconstructive surgery residency, you've passed written boards or oral boards, and you're a legitimate plastic surgeon. The other thing you want to check is to make sure that your surgeon is an experienced facelift surgeon, that they have done a lot of facelift surgery, such as I have, that can show you a lot of before and afters, and really you want to make sure you're comfortable with them as your surgeon.
Can I ask, how long does it last real fast?
So skin-only facelift's not that long. The SMAS lift, about 7 to 10 years. The deep plain facelift lasts longer, about 10 to 15 years.
Oh, okay. Well, that age range works out perfectly.
Yeah.
Dr. Magge, thank you so very
Thank
much.
you.
Of course.
Learned a lot
Fascinating.
from
yes,
you. Yeah.
we did.
For more information, you can go to cosmeticplastics.com or give them a call at 301-493-4334. You can also follow Dr. Magge on Instagram at Dr. Magge DC. That's DrMaggeDC.